Childhood trauma and schizophrenia, understanding the roots and overcoming symptoms. Hi, I'm Dr. Tony Weston. Have you ever wondered why some people develop symptoms that resemble what we now call schizophrenia? In this series, we're going to explore 5 mental health conditions: schizophrenia, bipolar disorder, major depressive disorder, obsessive-compulsive disorder, and alcohol use disorder, and their deep connection to early life trauma. Drawing from recent research using the early trauma inventory, we'll see how these conditions often stem from complex childhood experiences, reshaping our understanding of their origins. Historically, places like Victoria Park in East London, where we visited yesterday, and the asylums of the 19th century, also established around this same time, reflected society's evolving ideas about mental health, shifting from viewing these conditions as moral failings or biological diseases to recognising the role of environment, trauma, and the need for healing spaces. Just as these green spaces and institutions aim to provide respite, today we're rethinking the source and treatment of mental health problems, moving towards trauma-informed care and recovery. Join me as we uncover how our understanding of mental health has changed and how modern approaches can offer new hope for people who seek help with mental health problems. Schizophrenia is often thought as a mysterious condition, but emerging research suggests that it can in part be connected to early childhood trauma. In this video, we'll explore how complex trauma in childhood, whether emotional neglect, abuse, or disrupted attachment, can shape our brains and lead to the development of schizophrenia-like symptoms. Complex trauma refers to chronic, prolonged experiences of trauma during childhood, typically involving primary caregivers. For a developing brain, this environment can be disorienting and destabilising. When a child's sense of reality is constantly challenged by unpredictable or harmful caregivers, they may retreat into inner worlds to cope. Over time, this disconnection can contribute to symptoms like delusions, hallucinations, or paranoid thinking, hallmarks of what we now call schizophrenia. From a psychological perspective, trauma fractures a child's ability to trust their surroundings and their own perceptions. The brain, trying to make sense of chaotic or abusive environments, often creates alternative interpretations of reality. Over time, this can evolve into what looks like schizophrenia, where reality and fantasy blend in confusing ways. When caregivers are a source of harm, children develop insecure attachment styles, anxious, avoidant, or disorganised. These attachment difficulties disrupt their ability to form healthy relationships and can fuel the social withdrawal seen in schizophrenia. While schizophrenia can be a challenging diagnosis, there is hope for those whose symptoms stem from early trauma. By addressing these root causes, we can work toward healing. Therapy, especially trauma-focused, helps individuals process and reintegrate traumatic memories. By resolving these early wounds, symptoms like delusions or paranoia can gradually decrease. Learning how to ground oneself in reality through mindfulness, cognitive behavioural techniques and support systems can help reduce disconnection and distortions in perception. Developing healthy relationships is crucial. When individuals feel safe with others, their sense of reality stabilises, helping to combat the isolation and paranoia associated with schizophrenia. Schizophrenia, especially when linked to childhood trauma, doesn't have to be a life sentence. With the right support through therapy, grounding techniques, and building secure relationships, it's possible to reduce symptoms and lead a fulfilling life. Healing is within reach, and it starts by understanding the deeper roots of the condition. Thank you for watching today. Remember, healing from trauma is a journey, but with the right tools you can regain control of your mind and your future. Take the first step, seek support, and begin your journey toward mental clarity and peace. Thank you for watching.